Okay, hi, it's Dr. Buford. We're just getting started on the left knee. We've already harvested some bone marrow and made a bone marrow concentrate or stem cell injection to use at the end of the surgery. And now we're getting our first look inside this medial compartment where we can see some of the arthritic change and why we had the discussion about using bone marrow concentrate to help your results down the road. Try and preserve some of this cartilage and keep it from going away. So you can see some areas here on the tibial plateau medially where there's full thickness loss of cartilage. We can see the anterior horn of this medial meniscus actually looks pretty good. And as we look up at the femoral condyle, we can see a matching area where there's cartilage that's missing. The kind of yellow orangish area is subchondral bone, so we can see that we're down to bone there. And as we get even more medial, we can see another area far medially here that's also missing the cartilage. So the more normal cartilage is what you see over here a little bit more to the right, which is more lateral. See how this is kind of white? That's the more normal cartilage. Right now I'm just making sure there's no very loose pieces, and at the same time we're flushing a bunch of salt water through the knee. So you can see there's another loose flap. Those flaps are very thin and really not repairable. Our stem cell injection is really the best thing for that type of cartilage injury. We'll show you some more in just a minute. Okay, so we're looking at this radial tear in the posterior horn. We're going to try and repair it. There's a pretty good shot of that split. We're going to try and put a side-to-side stitch in it at the back just to prevent that from progressing. While we're getting that organized, I'm going to look around the rest of the knee. So here's the anterior cruciate ligament. That looks great. Okay. We'll look in the lateral compartment here in just a minute. Okay, so this is the lateral side of your knee. There's our shaver coming in. We're using it more as a probe right now because the cartilage surfaces here look like they're in much better shape. No significant tearing in the meniscus. Even that inner edge, if I turn on the suction, that's sometimes a good way to tell if it's loose. But see how most of that meniscus is very stable. Okay, so I don't think we have to do much there. As we look towards the back, we can see the popliteus tendon back there. That looks good. Okay, you can come on straight again. So now we're going to look up in the patellofemoral joint. You can come back around. And we'll show you some more in just a minute. Okay, so now we're looking at the patellofemoral joint. That's your kneecap or patella at the top of the screen. This little notch is called the trochlea. We can follow it all the way down the front of the knee here. And that's checking out pretty good. So you do not have any significant arthritis in the patellofemoral joint. You have some on the patella up above, but not much in the trochlea. That looks pretty good by and large. And we're just flushing a bunch of salt water through right now, just trying to make sure there's no loose pieces. Okay, so now we're going to get back to work on that medial meniscus. Okay, so I just wanted to show you the tear again. We're back on the medial side. And there's our best look at the tear. Okay, so here you can see the suture and the knot pusher coming down. And we're just trying to approximate that tissue and hold it together. I think that's pretty good right now. We're going to tie some more half hitches and show you some more in a minute. Pause, please. Okay, so we put our stitch in. I'm not going to do another one because I don't think we have room. But we've got that stitching at the periphery. So the next step for me is to take a small needle and place our stem cell injection right at the meniscocapsular junction there. I'm going to make sure there's no loose pieces as much as I can take care of that problem. And now we're going to take a 25 gauge spinal needle and place it back here. So yeah, you can, yeah. Okay, recording. So here you can see our small needle coming in. You can see the direction that we're heading with it. We're going to start here and then just work our way back. But you can see how we just go into the meniscocapsular junction here. And then we'll just inject. Now, it's only going to hold probably 1 or at most 2 cc's in the periphery. We'll turn off the water. So this will be the end of the videotape. Let me turn off the water and drain the knee. You'll see kind of what happens when we do that. Pull the suction off of that. Right here. We'll just take out a little bit of the water. Okay. And now we have the water turned off. We're going to go ahead and inject, and then we're going to get you back to the recovery room. So good luck to you now. I really hope this does the trick. Bye-bye now.